Hello, everyone. Welcome. Just give me a minute here. All right. So this is the second edition of the Activa Wellness series. We're happy that you can join us. Thanks for joining us. And if you haven't done so already, if you can quickly just subscribe, the button below, that'll keep you up to date with any content that we put out in the future. You can also join our Facebook, Twitter, Instagram, and LinkedIn. A little bit about myself. My name is Dr. Mike Romeo. I'm one of the chiropractors at Activa Clinics. I've been a chiropractor for 9 years now, and a little bit about Activa as well. It's one of Canada's leading providers for comprehensive healthcare services, and we provide wellness services such as chiropractic, physiotherapy, massage therapy, acupuncture, orthotics, and some of the things that we specialize in are work-related injuries, motor vehicle accidents, injuries, sports injuries, and any repetitive strain injuries. And our lovely staff can help you with any of the direct billing options that you may have with your insurance provider. If you have any more questions or concerns, you want to learn some more about our clinics, you can just visit activaclinics.com. All right, and today's topic is, I'm sure you know, is headaches. All right, so one of the top 10 causes of disability in North America and around the world. I think it's probably 8 or number 10 on that list, and for good reason. There's various types of headaches, hundreds of types of headaches, and they can be broken down into categories. So there's primary headaches as well as secondary headaches, and we'll go over the different headaches in each category. But it's important to note that over 95% of the headaches that we feel mostly don't need any specialized referrals or treatment. Okay, so means they're not life-threatening and no need for concern. Only a small percentage of those headaches are. And every year, up to 50% of the adults in North America will experience a headache. Okay, so even though they're not mostly, for the most part, life-threatening, over 30% of people who get headaches do require or do request specialized appointments or referrals because of the impact it has on their life, so disability-wise. Okay, so the first type of headache is, we're going to go over our the primary headaches, which are migraine headaches, tension type headaches, and cluster headaches. Now, the first two are more common. Cluster type headaches are not as common, but I'll just briefly touch on those. Now, the migraine headache is probably the most common headache that people come to us describing that they have or have been diagnosed with. Okay, everyone says, I've had a migraine, or I suffer from migraines. I have a migraine for several weeks now or several days. And most of the time, it's actually not a migraine. Okay, so they're misdiagnosed as something else. Okay, and we'll go over those type of headaches as well. So a typical characteristic of a migraine is it can have an aura. Okay, usually they do, and sometimes they don't. But the ones with aura, basically what it means is they get visual problems before the headache, or a discoloration in their visual field, or blurriness, or sometimes a complete blinding of one side of the visual field. Now, because of that, they can be quite scary or alarming, and because that is typical of some other types of headaches associated with stroke, that would be concerning. But with this one is you get those visual disturbances, and then it goes away as soon as the headache happens. And the headache can last anywhere from 3 to 72 hours. Okay, so this is the time frame that is important, because if you've had a headache longer than that, it's not a migraine anymore. Okay, it's not a migraine, and it could be something else. Okay, and will go away on its own. Now, preventatively, these type of headaches are treated with medication. Okay, it's hard to, we're not entirely sure how they happen. We used to think that it was a vascular or a circulation problem in the brain. Now we think it's more of a nerve problem in the brain that causes these sensitization of the tissues, of the nerve tissues, causing the headache. Now, they are usually caused by a trigger. Okay, so a usual headache, people will come in and say, if I eat certain foods or I do certain activities, I will get a migraine shortly after. Okay, so again, to treat migraines, they are usually sought after to primary care physicians and are given medication to prevent the headache. There's different type of medication to prevent as well as during the migraine. And sometimes people get referred to for Botox injections. So Botox injections will be done in the back of the neck, which tells you that there is a connection between migraines and the neck, because that's where the Botox will try and paralyze the muscles in the back of the neck that are causing pressure. And if that helps, then the neck is involved in the migraine. Okay, so some of the other issues that you need to look for with the aura is people also have slurred speech when it comes to a migraine. Again, very similar to a stroke, but people will have a history of migraines. Okay, so it's not usually a one-time thing. Okay, now when it comes to, like I mentioned, the neck, some people get relief from migraines with chiropractic care, because there can be a cross communication with the nerves of the neck in the brainstem with the nerves of the head and face. Okay, so if that is the case and those nerves are sensitive, then chiropractic treatment or sometimes massage will help to reduce the intensity or even relieve migraines. The next and most common type of primary headache is a tension type headache. And this is what most people will have if you suffer from frequent headaches. About 60 to 80% of all headaches are classified as tension type headaches. And these are caused by the muscles of the neck. Okay, so you have a number of muscles in the neck that can cause referral patterns. So that means that pain in or sensitivity in one area can cause pain somewhere else. So the muscles of the neck can refer up to the top of the head, the side of the head. Muscles of the jaw as well can cause these tension type headaches. And the difference between this and migraines is the migraine will be on one side most of the time, so unilateral on one side of the face, the eye as well with the visual problems. Tension type headaches are squeezing type pain on both sides of the head. And people will describe a pressure type of pain. And this is more of a dull ache and is more constant compared to migraine, which is like a throbbing pain. Okay. Now, just so in terms of reducing the pain in a tension type headache, most people will also rely on medication for this. They don't know what's causing it, so medication will typically help with these, but it's not going to treat the cause. Okay, so the cause of this is muscular tension and should be looked at. So one of the things that you can do at home, try to reduce stress as much as you can. If you want, so one of the things you can do for stress is improve your sleep. So sleep is very important for reducing stress overall and reducing neck tension to especially with our day-to-day life where we're sitting in front of computers a lot, the neck will tend to get very tight. That's just a matter of how we work and we function nowadays. But moving all the time, stretching your neck, and some meditation practices can help reduce some of that tension. The cluster type headache, again, I said this is not as common, but is one of the type of headaches that we do see. It will happen repeatedly. So this one's different, that it will happen over a period of time, 15 minutes to an hour and a half is the time frame, and they'll happen repeatedly. They'll come strong, and then they'll go away and then repeat for that time period. Whereas the migraine and the tension type headache will be fairly constant throughout their time frame. And for whatever reason, This type of headache will be more common in men and will be associated with one-sided symptoms, just like the migraine, but will be more autonomic or stress-related. So you'll get tears on one side of the face. You'll get drooping of the eyelid. You also get sweating and nasal congestion. Whereas the migraine is typically more visual related. Okay, so just a summary of the primary headaches, the more common ones. Migraine, so to review, one side of the head, usually, and associated with visual disturbance before the headache. Then the headache will happen, and then 3 hours to 72 hours. Tension type headache, both sides of the head, feels like a squeezing, not a throbbing, and that one can last about the same time frame or even longer, right? And this will be a fairly constant type of pain. And the cluster, again, short period of time, but will repeat. So primary headaches, those are the more common types of headaches. Secondary means that they are associated with something else. Okay, so the most common thing is a direct trauma to the head and to the neck. So either a direct blow to the neck or the body. Very common to have in car accidents or in sports-related injuries, these secondary headaches can arise. There's also headaches that can be caused from medical dependency, as well as from the eyes, problems with the eyes, ears, nose, sinuses, teeth, and mouth. All these can cause a secondary type of headache, or even triggered by foods or activities. So these are the specific type of migraines we talked about earlier. If they're triggered by something, then it can be classified as a secondary type of headache. The ones that are related to direct trauma, so a blow to the head or in a car accident, for example, there's two injuries in particular that I'm talking about, and that's concussion and whiplash. Okay, now most of the time those two will be associated together. If you have been diagnosed with a concussion, then you 100% will have a whiplash injury as well, because the force needed to cause a brain injury, which is what a concussion is. I'm not going to go into the details of concussion here, but it's basically a brain injury. If you had enough force to cause a brain injury, then that's more than enough to cause a neck injury as well. So you can't have a concussion without whiplash, but you can have a whiplash without a concussion if the force is reduced. Okay, so concussion-related headaches, those will be classified mostly under tension headaches. Okay, and they can be after a period of time following the concussion. The whiplash is again the acceleration. So both of these are due to acceleration of the head and neck and causing damage to the tissues of the neck. So we'll talk about that next. And those are more specifically classified as cervicogenic headaches. So cervicogenic headaches are headaches related to or caused by the structures and joints of the neck. So the tension type headaches are more muscular. The cervicogenic are more joint related to the ones in the neck. Okay, now this is the headache that is most likely misdiagnosed or confused with migraines. What I mentioned earlier, that people will always come in or usually come in and tell me that they suffer from migraines, it's usually this that they actually have. So it's one-sided, just like the migraine, and it can cause sensitivity of lights and sounds, just like a migraine. Okay, so that is the similarities, but the difference is what they feel. So in a migraine, people will feel, remember, it's a throbbing, intense pain, and in a cervicogenic, it's more of a strong ache feeling. Okay, but again, on one side, unless of course you have injury to both joints, both sides of your neck, and the joints are involved, then you can get this headache on both sides, but it's typically one side. And another difference is this one could be more constant, right? So these are the headaches that can last several weeks, several months, and become chronic because they're associated with the neck tissues, the joints. If they haven't healed or repaired, then this can be an ongoing thing and needs management. Another thing people will describe with this type of headache is it'll get worse with movement. Okay, so if you look up or look to a certain side and the headache intensifies, then you know that it's related to this. Okay, and again, this is typically confused with either tension type headache or migraine. And some of the muscles that cause this we'll go over and at the end to kind of show you where these headaches are coming from so that you can do something at home for it. The next type of headache is withdrawal or rebound headaches. So the problem with not trying to figure out the cause of your headache before getting medical intervention, getting like different medications, is that now it complicates things because the medications will help the pain, but after a certain point, your body will become dependent on the medication. So if you start to wean off of the medication, you may notice the headache coming back and you think it's the original headache, when in reality, it could just be your body is now accustomed to the medication and is now giving you a rebound headache. Okay, if you don't take medications, think of it, and you do drink like something like coffee, you'll notice that if you miss your coffee, sometimes I miss my coffee in the morning, you'll get a mild headache within a few hours to the afternoon. Okay, and that is that withdrawal from the caffeine. Okay, so same thing with medications. So things like acetaminophen or Tylenol, aspirin, opioids. So those kind of drugs, migraine medication specifically, those kind of drugs can lead to this type of withdrawal headache. Okay, so you got to be careful with that. If you are on regular medication, it can confound or be difficult for your practitioner to figure out where the headaches are actually coming from. Okay, so those are the less, I would say, serious of the headaches. Now we'll go over some of the more serious ones that we need to look out for when you come to us with headaches. There are certain type of headaches that we need to rule out, and those are more emergency situations. Okay, so these are the ones related to neck and head circulation or circulatory issues. Okay, so things like stroke, hemorrhage of arteries in the brain and the neck, as well as bleeding in the actual skull cavity. Okay, so the stroke and the bleeding in the brain will have certain presentation. Okay, one of the ones is called a thunderclap headache. Okay, so this is a headache that comes on very strong. Okay, very intense. There's no warning like a migraine where you get visual issues. It comes on very strong. That's why it's called thunderclap, and does not go away. It doesn't reduce. That is a flag. Okay, we want to, headaches should fluctuate in their intensity. If it doesn't, this is an issue. Okay, so this is typical in a stroke type of headache, as well as a epidural hematoma. And some of the things that we want to look out for, some more popular symptoms or signs that we're aware of are dizziness. If there's a blackout, so you pass out and drop to the floor, a double vision, trouble speaking, nausea, vomiting, numbness on one side of the face. These are all things that raise red flags, should go to the emergency, but sometimes they end up in our office, and we have to be aware of those signs and send them to the emergency right away. Okay. And then there are headaches caused by the nerves of your neck and your face. Okay, so these are called cranial neuralgias. Okay, and the main nerve of your face is called a trigeminal nerve, and this type of pain that people feel is more of a burning type of pain. Okay, so migraines are more throbbing, tension are more ache, as well as the cervicogenic are more of an ache. This is a burning type of pain, like your face or your head is on fire. One of the more common ones we see is called occipital neuralgia. They start in the back of the head, and it can radiate to the top of the head or the front, right behind the eyes. And again, it's more of a burning type of pain. And also you can feel it behind the ears. One of the better options for this type of headache is acupuncture. It works pretty well for this. And again, for these type of headaches, most people will resort to medications to reduce the pain. But with most of these, you'll find a common theme that you will need to reduce the stress, reduce the inflammation in your body. So we'll talk about cleaning up the diet, improving sleep patterns, some meditation for stress, and overall increasing your activity. Okay, so exercise doesn't have to be crazy. 20, 30 minutes of walking daily will make a huge difference. All that's going to reduce the level of stress in your body and help improve most of these types of headaches. Like I mentioned at the beginning, 95% of headaches don't need any specialized referrals. They can be managed conservatively. Okay, now in terms of what to expect when you go see a practitioner, for example, at Activa, you'll get a proper history done to figure out when this all started, a proper physical exam to see if there is any physical causes of your headaches, and then a diagnosis to weed out all of the different types of headaches that we went through, and if it's one that we can actually help. Okay, and then give you a specific treatment plan to help you along your recovery. And if there is something that we are concerned with, like if it's actually related to a visual problem or a sinus problem, then we would recommend that you go see your family practitioner to get a proper referral that way. Okay, so just in summary, most of the headaches are non-life-threatening. Okay, migraines are one-sided with an aura, so visual problems, and throbbing type of headache that can last up to 3 days. Tension headaches, both sides of the head, more of an ache and associated with muscles of the neck and head. Cervicogenic, one side, confused with migraines a lot of times, but can last longer than migraines and associated with the joints of the neck. These are the ones that we can help the most. Neuralgias are related to the nerves and are more of a burning type of pain. And then commonly treated, these are all commonly treated with over-the-counter medications and prescription medications, but this does not treat the cause. Okay, this is all symptom management. Once you get off the medication, the problem's still going to be there. So it's important to find the actual cause of your headache and get it treated properly. Okay, and most headaches, most problems in general, but in headaches are going to be improved with better sleep, better diet, improved activity, and overall wellness patterns. So I'll give you a couple of things that you can do at home if you do suffer, if you notice that you do suffer from, for example, cervicogenic or tension type headaches. There are a couple tricks you can do at home to help relieve that. So if you're in the middle of a tension type headache, depending on what muscles are causing you the pain, one of the most common ones are called the suboccipital muscles, which are right at the back of your skull. Okay, so if basically you grab your hands like this, okay, so your thumbs are going to wrap around, you're going to feel the base of your skull right behind your ears. You have two large bumps there. Then you're going to kind of bring them in towards each other, and you're going to feel a soft spot. Okay, and that if you push into that soft spot, it might be tender. Okay, if that's tender or even causing more of a headache, that is where the suboccipital muscles are. And what you want to do is to gently massage those muscles in a circular pattern until you feel some relief. Okay, you may need to do that for an extended period of time if you have somebody to help you with that, and actually better if you can lie down and do it so your neck is relaxed and have somebody do that for you. That's a great way of helping to reduce headaches coming from back there. Another trick, one more trick, is right in the in your hand here, you have a meaty part between your thumb and your index finger right there. This is typically an acupuncture point for headaches. What you're going to do is you're going to pinch right in there. And if you pinch hard enough, your hand is going to feel quite achy. If you hit the right spot, you're going to feel an ache going into the whole hand. And for whatever reason, again, it's an acupuncture point. It tends to help reduce tension type headaches. Okay, it helps relieve some of that tension. You may need to switch hands after a few minutes because it does get sore. But those are two tips that you can use at home to relieve some of that tension. If those don't help, then obviously, even with any of these headaches, you will need to get assessed and get properly diagnosed and get some treatment. Okay, so let's look at some of the comments here and see if we can answer some questions. Let's see, can low blood pressure cause headaches or high blood pressure? Yeah, I mean, those can definitely cause secondary headaches. When I would say more high blood pressure, with increased blood pressure going through the arteries of the neck and into the head, that can lead to some discomfort in the head as well, but not something that we would help with. That's something that your family doctor would obviously assess you for, and then put you on the right medication, quick fix, lower your blood pressure. But even with that, a healthy diet, increased exercise, that's going to reduce your blood pressure naturally. And unless there's a congenital issue that it happens no matter what you do, then that will need medication. Okay, let's see if there's any other questions. What are some of the temporary relief measures that I can take if I have a headache and I don't want to take medication, but there's time between when my headache happens and my appointment? All right, so some of those tricks that I just used, so pinching of the spot right here, massaging the back of the head. Also, like I mentioned, it's always good for most people to get some sort of allergy test or food sensitivity test. Most people won't get full-blown allergic reactions to the foods they eat, but they don't know that they're actually sensitive to types of food. Those foods can lead to irritation and inflammation in your body, cause all sorts of problems, and one of them are secondary headaches. So reducing those foods, improving your overall health with exercise and reduce stress management. Maybe we can do later on, we can do another series about meditation or mindfulness that will help with that. But those will help relieve the headaches or help reduce some of the tension in between your sessions. Okay, I think that is everything. So I just want to thank everyone for joining. I hope you enjoyed the session. And if you do have any pain symptoms that do linger on, don't hesitate to call us or visit our website to book your appointment with a physio or a chiropractor to assess you. We will announce the winner of the free 30-minute massage. So leave a comment, either if you were live or even later on. We'll give it a day or two to get that going, and then we'll draw a winner for your free 30-minute massage. So stay safe, everyone, and don't forget to subscribe so you get the info for the next session. And good night.